Well, here's a shocking statistic. 42% of South Carolina women experience intimate partner violence, be it physical, sexual, or stalking during their lifetime. 42%. Programs and services aimed at protecting and advocating for their well-being often become a lifeline that contributes to their survival. We'd like to welcome back Tosha Connors, CEO of My Sister's House, a safe haven for domestic violence victims. Great to have you back.
Thank you for having me.
So the last time we spoke, you've had some updates at My Sister's House. Before we get into those, maybe you could just lay the groundwork and let our viewers know exactly what it is you do.
Certainly. So My Sister's House is the oldest and longest standing domestic violence agency. We serve Charleston, Berkeley, and Dorchester counties. And over the course of our 40-year history, we've really grown to become much more than a shelter. So we've expanded our program services to really offer a holistic continuum of services for domestic violence victims in the Tri-County area.
And what kind of programs are we talking about? Because when we think about domestic violence victims, going to a place where they feel safe, that's number one. So I imagine there's shelter involved, but it goes well beyond that, like you say, very holistic approach.
It does. So certainly we've been known for our sheltering services over the last 40 years, but what we've recognized and come to understand is that that's just one piece of the puzzle, right, of the solution. So if we really want to break barriers, if we really want to break the cycle of domestic violence, we have to get to some of those root causes. So we're talking about healthy relationships, which goes back to our education and training programs that we have. So we have some fundamental pillars that we really try to focus on. Schools, law enforcement, the faith community, those are the areas where we think that if we can get in front of kids earlier, if we can teach them about healthy relationships, healthy boundaries, and really model what those things look like at a young age, then you're breaking those sorts of habits. When you have a client who comes in for therapy, for instance, and we have a very robust clinical program, if that individual, say, is 21, 25, they've had 10 to 15 years perhaps of dating experience, right? You're trying to break these behaviors, so you don't just come in for one session and then I'm healed, right?
Right.
These things take time. So we have had to figure out, how do we get to these root causes? How do we shift our programs to meet our clients where they are so we can address some of those root causes?
And I can only imagine that COVID certainly made things rather challenging, and so you had to adapt. So that lends itself to some of the updates that you've got for us. So tell us just how that period was and what has happened since.
Yeah, so I think nonprofits in general, you always have to be nimble, right? You're trying to figure out how to navigate the system, and COVID threw everybody for a curve, certainly with our emergency sheltering services. So previously we were offering emergency sheltering services in our shelter, which is a congregate care setting. So there were individuals who were sharing space, living space, dining space, their children were sharing space. And there are a lot of benefits, and then there's some drawbacks to that. Naturally, when we had to consider these health concerns for our staff and for our clients, we decided to move out of that setting, and we started utilizing some private sheltering models during the course of the last 2.5 to 3 years. We recognized that we were having some really great outcomes, and we got a lot of positive feedback from the clients that were coming into our services. So there's a certain sense of autonomy, of freedom that exists when you're not in that congregate care sheltered setting. We did a lot of research. We've noticed that there are a lot of other agencies in the U.S. who are adopting this model with great success. And this is something where we really had to listen to our clients. So it's not what Tosha wants or My Sister's House wants, right? It's what does the client need, and how can we adapt to fulfill those needs so that person can have some really great outcomes.
Isn't that something? So it's almost like it was a blessing in disguise. I mean, I hate to say it, but people did get sick, but it really kind of pushed you down another path that actually has turned out to be quite beneficial for your clients.
It did. You're right.
And so also, in addition to the services that you provide, you also have court advocacy as well. That's a big part in kind of getting there, right? And so what do you contribute to kind of get them to the right people, right place?
Yeah, absolutely. So this whole idea around access to justice, right, and how we grow that program has really been at the forefront of what we are looking to do in the coming year, 2 years. So we have a court advocate. If you are looking for an order of protection, if you need somebody to accompany you to court, it can be very overwhelming. Sometimes it's the first time that you've seen your abuser since you've separated. There are a lot of feelings that come with that, right? If you're an attorney or a judge, you may not fully understand why that client is now recanting or I don't want to move forward with this because I know what that look means because I've had to deal with it. I've had to live with it for years. So that person doesn't have to threaten you overtly. They can give you a look. And so it's really nice when you have an advocate there with you. We're also expanding our partnership with Charleston Legal Access. They're a nonprofit law firm. They're based in the same location as my sister's house. So we're able to easily refer clients back and forth. And that's also been a blessing. So our clients can have immediate access to an attorney, have a consultation, really understand what their rights are, and maybe how they might be able to navigate that legal system together.
Wonderful. That's wonderful. My sister's house is a place where life can begin.
Yeah.
That's fantastic. And for people who are watching this who are interested in more information, where do they go?
They can go to our website, mysistershouse.org, or they can also reach us on our crisis line, our intake line. We have an outstanding staff who are standing by to help you.
Tasha, thank you so much.
Thank you,
Appreciate
Layla.
your work. We're back after this.